What are the screening modalities for breast cancer? So mainly breast cancer screening modalities are breast self-examination, where we recommend the patients above 30 years of age to do a self-examination of their breast monthly once or once in 2 months, so on and so forth, to look for any lump in their breast, to look for any abnormality in their nipples or any nipple discharge or lump in their armpit. Along with breast self-examination, we also ask for a breast clinical examination by a trained nurse or an oncologist or a physician who has been trained in oncology. This can be done on an annual basis for women between 50 to 75 years of age. And then we have certain diagnostic tests which are used for breast cancer screening. We recommend bilateral mammography as a screening modality for women from 50 to 75 years of age who are at an average risk of developing breast cancer. So average risk in the sense, it is like a routine process where they are not at an increased risk of developing breast cancer compared to normal population. Here we ask the patients to get a mammography done on an annual basis from between the ages 50 to 75 years of age, and based on the findings on the mammography, we ask the patient to take action accordingly. So if the patient has a normal mammography, we ask them to routinely continue their screening. If a patient has a suspicious lump or a mass in the mammography, we either go for a biopsy to confirm that lump, or we may repeat the mammography after a few months of time. There are certain screening modalities for women who are at a high risk of developing breast cancer. So women who have a family history of breast cancer, who have a first degree relative that was diagnosed with breast cancer. First degree relative means sister or mother who are at an increased risk of developing breast cancer. Apart from this, women who are carrying certain genetic mutations, or they are directly related to people who have these genetic mutations such as BRCA1, BRCA2, or girls who received radiation in their adolescence or childhood for treatment of any other cancers. These women are categorized as having high risk for developing breast cancer. We need to use different screening modalities for such women. So for high risk women, we recommend starting screening as early as 30 years of age, and we also recommend using MRI of the breast along with mammography for screening high risk women, because sometimes mammography may miss certain early lesions which can be picked up by MRI. So now these are some of the screening modalities for breast cancer. Mind you, screening does not prevent breast cancer. We are only detecting breast cancer at an early stage, and we are able to cure the disease of that particular patient. On that note, I conclude this video. For any queries or comments on breast cancer or any other cancer, please feel free to approach me or my team. Thank you so much.